everyone. I'm Dr. Sandeep Sharma, PrepLadder Super Specialty Faculty in Pediatrics. So the NEET SS results are out, and today we have not one, not two, but three very special guests with us. All the three students here, they have got stupendous ranks in the recently held NEET Super Specialty exam in Pediatrics. We are pleased to welcome Dr. Shruthi. We are pleased to welcome Dr. Vidya and Dr. Vikas to this interview. Congratulations on all of you.
Thank you.
Thanks.
Thank you, sir.
So before we start, we would like to know what rank you have got, what is your background, from what place you have done your UG and PG from. So we'll be starting with Dr. Shruthi. Dr. Shruthi, over to you.
Hello, sir. I'm Dr. Shruthi. I'm from Pondicherry, sir. I've secured a rank of 46 in this NEET SS. I did my UG from Melmaruttur Private Medical College and my PG from Tanjore Medical College. That's it.
Great. And Dr. Vidya?
Hi, sir. I'm Dr. Vidya Selvakumar. I secured a rank of 35 in this year, NEET SS. And I did my UG from Karpaganaga Institute of Medical Sciences. And I did my PG from Madurai Medical College, Institute of Child Health and Research Center, Madurai, sir.
Great. And Dr. Mupa? Dr. Mupa Vikas?
Hello, sir. I secured a rank of 40, sir. I am from Warangal district of Telangana, sir. I have done my UG from Usmania Medical College, Hyderabad, and post-graduation from All India Institute of Medical Sciences, Bhubaneswar.
Okay. So first of all, I'll be interested in knowing, was it your first attempt or was it you have previously appeared in the exam? If this was your first attempt, obviously you'll be very fresh to it. But in case you have appeared previously in the NEET SS or the preceding INI-SS, how did you find this exam different from the previous one? So we'll be starting with Dr. Shruthi.
I had given my exam last year, sir. My rank was 149. This year's paper was a bit tough compared to last year's because the questions were more direct last year. This year it was quite indirect, and I really felt the paper was tough. So without preparing properly, I couldn't have attempted the question paper at all. So that's what I felt.
Okay. And Dr. Vidya, your views on this?
Sir, I am completing my PG this year only, sir. July 2023 only I have given my exams, and this is my first attempt, sir. I have been using PrepLadder for past 1 year, sir. I have used it for my postgraduate exams and medal exam, which is conducted in Madurai, as well as for the NEET SS, sir. It has been my companion all throughout the year.
Great. So that means even if you were sitting for the first time, still you had that base oriented towards the exam.
Yes, sir. That helped me a lot.
Yes. Great to know that. Dr. Mupa Vikas, your views on this NEET SS exam. Have you appeared previously before?
No, sir. This is my first attempt, sir, actually.
Okay.
I felt like I expected more of clinical basic things, but I felt like there are more one-liners in this exam.
Yes.
But we need vast reading, like, as you said, we need horizontal learning for this unique kind of.
Yes. So this is a common thread. So all of you who are listening to it, because there are three people expressing their own opinion, I'll be summarizing whatever all they are saying. So two of them have appeared for the first time, although they have been preparing hard for the exam. And Dr. Shruthi, this is her second attempt. It was a tough paper. There were more number of facts, more number of one-liners compared to previous year. There will be clinical questions, of course, but the weightage this year was slightly less compared to the previous year. Having said that, one thing which almost everyone has said, it was a tougher paper. So exams are tough. Don't think that you will just simply come out, into a park and take a stroll. This exam is not going to be like that. You need to have that mindset and the preparation level. So coming to preparation level, Dr. Shruthi, what is the time around which you started preparing, and how much time do you think is essential for someone getting a rank in the top 50 in NEET SS?
I was of the idea of taking SS since my PG, but we didn't get enough time to prepare back then. So seriously, I prepared for the last 3 months only. Last year's attempt was as a fresher. I gave the exam without any preparation. So I just wanted to give my best, and so I just prepared for the last 3 months sincerely.
Great. And Dr. Vidya, your views on this?
Sir, I haven't been exactly preparing for this. I have used PrepLadder as a companion throughout the year during my final year for my final year exams. But the approach videos and everything was useful even for clinical bedside as well as for my postgraduate exams. And particularly the MCQs which I practiced were mostly from the clinical side, sir. So I did not specially go for NEET SS, but I had a general idea about it. And the last few months only I have been practicing out the MCQs and the question banks. The remaining videos were the most ones, and I took notes from your videos, and I had to revise all those notes at least 3 or 4 times, and that was very helpful, sir. I did it at different spacing, not regularly and all. I did it whenever I had some doubts in a concept. I just had to go through the notes, and I had better idea of it.
Great. And Dr. Mupa Vikas, your views on this?
I've started my preparation after completion of my PG, sir. I've completed my PG in January 2023. But like I was preparing for INISS. I started preparing seriously after this July, sir, for last 3 months. And before July, I've completed around 20 to 30% of the videos from PrepLadder. After, like, I was not able to complete all the videos, but I was able to read all the slides and notes which were there in PrepLadder. Yes, sir. And some other things. Yes.
Great, great. So just want to know about it's a battle out there. So in every battle, you need to have your favorite weapons. So what are your weapons, your primary areas which you focused on? Textbooks, any additional textbooks, subject-wise textbooks, and what was the role of PrepLadder in your preparation in helping you out? So Dr. Shruthi, we can start with you.
Sir, basic was Nelson only, sir. From Nelson, I had taken notes for all the systems. I had a note for a separate note for each system. And during my PG itself, I had completed that. After that, I subscribed PrepLadder, and I saw all the videos in 2x for those that already had points from Nelson, and extra points I added to the same notes, so that at last I had one common source for viewing everything. I added the notes of MCQ questions also, which I didn't know. I added those points to the notes. And in last 10 days, I kept revising the same thing again and again. Only that's it. And I didn't prepare from special books for each subject everyone will use. I didn't do all that. I couldn't do. PrepLadder was really helpful for adding those extra points other than that to Nelson.
Great, great. So this is a common thing. See, we all of us, all of you who are listening to this interview, we are all pediatricians, and we all know whether you are in Trivandrum or in Delhi or in Chennai or in Bengaluru, you are going to have a lot of hectic duties. Sometimes ICU, PICU duty, NICU duty, casualty posting. You will not get any time to read. So whenever you get some time, try to read and keep adding points to the Nelson. And end of the day, Nelson has to be your go-to book. You cannot, crack the exam without reading or taking shortcuts in Nelson. Dr. Vidya, you agree with it, or you did something extra apart from this?
Sir, I agree with you, sir. What I based on my during my studies is that I completely read Nelson, sir, and I took notes system-wise for all the systems in separate notebooks. And for clinical purpose, I remember I had to present a case in my ward, and for preparation's sake, I just went through this video in cardiology. You had explained about tetralogy of Fallot. That was the first video I have viewed in that. And after seeing that, I got inspired, and I wanted to subscribe to this package. And only then I went on with the videos and started taking notes from PrepLadder, especially for every subject in the note. And then I added points again from the specialty books. For path cardiology, I have referred, and Ria's gastroenterology, like that. System-wise notes also I had to add on to it, sir. And I also referred to some recent journals. You had also covered most of the journals and all in video as well, sir. All the updates were really, really useful. And most of the journals also you had covered in your videos. So that job was, it made it easier for us.
Yes. See, that was the whole purpose. I have been a resident myself, and I know that it is very difficult to sneak out time. So my purpose is to simplify the concepts in Nelson and then add a sprinkling of some masala in the form of some updates from the journals, and glad to know it worked for most of you. So Dr.
Yes.
Mupa Vikas, what were your primary resources that you used?
As you told, like we never get any time during the post-graduation time. So during the we'll get some time between the rounds or during the lunch. Like my main preparation during the PG time was from review articles and all those things, sir. Second part of the Nelson, I have covered almost most of the things, but first part of the Nelson, I was not able to cover. But for most of the topics, I had articles in my phone. I used to label them and keep them in my phone. So during during the NEET SS preparation also, I've used those articles and tables from Nelson, and I used PrepLadder.
Okay. So common thing to summarize here that you get limited time. Nelson should be your go-to resource. At the same time, you can consider adding some additional textbooks if time permits, and try to make your own notes and keep adding to one source so that you are able to revise it multiple times close to the exam. So we'll be starting with Dr. Mupa Vikas now again. So Dr. Mupa Vikas, what were the sources of solving MCQ? Did you solve MCQs at all, or you because this is something once we crack the PG entrance for the next 3 years, we don't really solve much MCQs. So what was your approach towards MCQs and how rigorously did you practice them?
Solving MCQs is must to crack any MCQ exam, competitive exam. Without solving MCQs, it's not possible. MCQs and mainly the grant test, what we write, they are most important, sir. Like I used PrepLadder for the grant test, sir, and some assistant professor exam question papers I had from the Google. I have solved them, sir, and that's it, sir. MCQs, I used PrepLadder for all the MCQs.
Okay, great. Dr. Vidya, your view on MCQs?
Yes, sir. MCQs and grant tests are like the most important during preparation phase. So I used a PrepLadder MCQ question banks only, sir, and I had enough time only for one grant test, sir. And as a person, I preferred that the MCQs, were of very good standard and the explanations were really good. Only one suggestion what I would recommend is that the same explanation was given for multiple questions, so that could be avoided. And instead of that, they can maybe go for add-on points, some other different points. I used to skip those same explanations, but sometimes it can also serve as a revision. So it is our preference. We can take it however we want. And coming to the grant test, it was really nice, and it helps us to know which percentile we are in. And in that, one suggestion is that the weaker areas could be highlighted so that we could focus on it better. We had to mentally work on which are the weaker areas. If there is some graphical representation of that would be really helpful.
Dr. Vidya, very well suggested. Points taken. It's always better to keep working on that. All of you have won your battle, but for the future exams, we are working on updating the Q bank entirely, and this weakness level and strength level kind of thing we will make sure, and duplication of references also wherever they are there. This is something we have already taken note of. So great for you to highlight this. So, and Dr. Shruthi, your views on MCQ solving?
I also use only PrepLadder, sir, because there are not much apps for pediatrics. Only PrepLadder was available. So Q banks were of good standard, but compared to them, grant tests were of better standard. The questions were of better standard. And of course, those comparison, I think there was a graph on that to compare with the first ranker and everything. So it was of very good help. I took 2 grant tests at last, only at the end.
Okay.
Yes, sir. I also wanted to mention that I usually used to compare my percentile with that rankers, and it was like really motivational, sir. That was a great idea. That should definitely continue. That comparing our rank and mark with every percentile, every person who stands, that was really great.
Yes. So it basically tells you that where you are standing right now. What happens is if you don't give a grant test, only reading theory or maybe solving some random MCQs, we tend to have a false belief that, okay, everything is going fine, right? So it's a false positive score, I would say. But only when you sit in the exam, you focus for 3 hours, and then you realize that, okay, these are my strong and weak areas. This is something very important. So all the students, all the future aspirants, please solve MCQs, please give grant tests. At PrepLadder, we'll try to create good quality grant tests. Please take them so that you know where you stand and you can take corrective measures before you actually sit in the exam. So moving further, I would like to ask Dr. Vidya this time. Dr. Vidya, suppose there is a junior of yours and he or she wants to prepare for the NEET SS 2024. What are your suggestions, do's and don'ts from your side to someone who's in final year of MD right now?
Sure, sir. Usually in our college, the first 2 years of our PG is very hectic, sir. The third year, they do give us some relaxation, ask us to focus on academics, which was really helpful. And we had supervision duties, and though we had ICU duties, between the ICU duties was the most great time which I used for practicing MCQs, because I could not sit and focus on a topic and study and take notes at the time. So during the gap which we get between the rounds or between the ICU breaks, that is a time where we practice MCQ. We should not wait for some particular time to sit down and study, find a cozy corner and also. During post-graduation, whatever time is available, that time we can make use of however it is possible. During a free breaks, we used to go through any journals and just jot down few points about it. And when we go through it again, it will be easier, sir. And if at all we need a study corner, that should be taken in a particular time. But it is not that we have to wait for the time and then start preparing, which it will be already too late, sir. And for my juniors, what I would recommend is that always studying from the book without taking notes will not be of any use. Personal notes should be taken, and it should be as concise as possible with highlighting important points. And revision of the notes at regular intervals will be better, sir. I did not do regular intervals, but whenever I had doubt or whenever I had discrepancy in while even seeing any patient in the ward, I just go back to the notes and read it, sir. So a clinical correlation along with the ward and the theory will be of greater use, so that the retention is better. Or else just theoretically, if we keep studying, it just runs out of my mind. That is my policy. I used to go back to the clinics and go back and forth from the clinics as well as the theory. So that helped me to retain a lot of subjects, sir.
Okay. So suggestions from Dr. Vidya's end are that don't wait for any perfect time. There is no perfect time in residency. Whatever time you get, read Nelson, make your own handwritten notes and revise them as much as possible. And it is not going to happen that somebody will give you 1 week off and you are only preparing for 1 week. That is not going to happen. To try to sneak in time, but try to be as consistent as possible. So Dr. Shruthi, your views on this, your suggestions to someone who's in final year and is going to sit next year, what do's and don'ts you will suggest from your end?
Nothing much to add, sir. As she said only, Nelson is the most important thing. And had I known, I would have subscribed for PrepLadder earlier during my PG times only. But Nelson is the basic. First, we need to take notes from Nelson only. And as she told, we have to keep adding points and keep revising at regular intervals. Only that, sir.
Okay. And Dr. Mupa Vikas, your views on this? Any suggestions for your juniors looking up to you?
During the post-graduation, I would suggest everyone to go for case-based learning. Whenever we see those cases, then we can read the topic, and whenever we see those cases again, we can revise those topics again. By the end of 3 years, we'll be able to complete all the topics in the lesson if we go for case-based learning. And for the NEET SS preparation, at the end of the day, exam is exam. We don't say using shortcuts. I don't use the word shortcuts, but it is the most effective way. Like the most important topics what were covered before in the previous exams. All those things we have to take a separate note, and we have to revise again and again.
Great. And what specialty are you going to take up now after this? Dr.
I'm thinking I was confused between pediatric critical care and neonatology, sir.
Okay. So you have to make your mind. It's fine.
Yes.
You have time now. Dr. Vidya?
I'm also yet to make my mind, sir. I'm interested, not in narrowing down much. So I think I'm, more towards pediatric critical care as well.
Okay.
I'm not yet decided on it.
You have time. You can take your call. And Dr. Shruthi?
Same thing only, sir. Except neonatology, I'm open to everything.
Okay. So the ranks that you have got, you will have a lot of opportunities, lot of options, and it's a good confusion to have. Talk to your seniors, talk to your family, and then look at the market dynamics where you want to settle. And based upon that, I think you should be taking a call. So being flexible is always great, and having a good rank is always a luxury which you all have here. So in the end, it's never a single person's effort. There are always people in the background who contribute to your success. So any special people who you want to dedicate this success to, any shout outs to someone? Dr. Shruthi, we'll start with you.
Family only, sir. They were very supportive. My mom, dad, my husband, my granny, my sister, my in-laws, everyone. They really supported me, and my teachers as well.
Great.
Only that, and only hard work pays at last. Hard work and presence of mind. Only that. However intelligent we can be, wherever we can come from, whichever college. Only hard work and presence of mind will pay.
Yes, absolutely true. Absolutely true. Dr. Vidya?
Sir, I would like to dedicate this to my parents. Sir. They have been my backbone, since especially for girls, they need family support in any field. But medical field, it definitely it is necessary, sir. My parents, my father and my mother and my elder sister, I thank her, and as well as the Madurai Medical College and my HOD, Dr. Balashankar sir, and my assistant professors. I were under their unit and guidance throughout these 3 years, and I could not repay them enough if I don't thank them.
Great, great, great. And Dr. Mupa Vikas?
I would like to thank my parents, sir, for supporting me all the time. And I would like to dedicate this success to all the faculties at All India Institute of Medical Sciences, Bhubaneswar, sir. They were supportive all the 3 years. They were always pushing us. Yes,
great, great. So to summarize, in the end, we had 3 toppers with us, each of them from a different part of the country. Each of them have done their UG and PG from very different, distinct places. But if you see, there are some common threads running through them. The common threads include, number one, they all relied on Nelson. Number two, I shouldn't be saying this, but I have to say that they followed PrepLadder and they incorporated it as a part of their preparation, right? So number three, there is no substitute for hard work. Number four, you need to sneak out time. You will not get that luxury of finding months at a stretch where you will start preparing. So you need to sneak out time and be consistent with your studies. And number five, solve MCQs as much as you can. PrepLadder, we are striving for excelling. We are striving for updating our Q banks also very shortly. So hopefully, whatever suggestions are there, we will definitely be incorporating them. And number six, it is always the blessings of the parents and a supportive family which helps us in cracking the exam. So great to have all three of you together, and it was my privilege to have taken your interview. So wishing all three of you the best of journey. May you decide the best branch of your choice whenever you decide, and may God bless all of us. Dr. Shruthi, Dr. Vidya, and Dr. Mupa, congratulations once again, and greetings to your family also.
Thank you
so much, sir.
Thank you so much.
So just one suggestion, sir. You usually give us some videos on how to choose broad specialties and all. If you could update
Point taken. I am traveling to Jaipur.
On videos on pros and cons on how to select the institute. That
coming
will be really
coming weekend 100%. I'll put
Thank you.
Thank you so much. Thank you.
Thank you, sir.